So good morning, respected Professor, they call it finally RC, I'll also call it RC, RC sir, Sundar, Amit Shah from Resolve to Save Life, Mr. Kumar, and my Deputy Director Sundal Nagarajan, and all the medical officers from the primary care who are assembled here on a Sunday as mentioned by them, and all the experts who are going to give the lecture on that. I thank again RC for this opportunity to speak with you all on this. Maybe I'll start with a small congratulations to you and your team and the Sapiens Health, sir. This biggest, what do you call it, is a major public health challenge or a developmental challenge, which usually a public health professionals will take care. So you being a clinician, taken this such a big lead and doing this as a public health strategy to control this non-communicable disease, much appreciated, sir. Thank you very much for taking a lead on this regard. We all know why we need to address this today. Maybe for the interest of the physicians from the primary care, we all know the non-communicable disease, which as per the global burden of disease, kills more than 75% of the population and almost 60-65% of your mortality, the complications, the challenges in Delhi are all because of this non-communicable disease. And if you need to address this non-communicable disease epidemic, definitely we need to touch upon those what we call it as a risk factors. So particularly the risk factors which are modifiable. If we want to see those modifiable risk factors, these are your salt, sugar, and little more your trans fat and all. So unless and otherwise, which you need to address these factors, it will not be sustainable for even for any country to manage the complications due to NCD. So for example, our Edwin sir will know our hemodialysis is the highest utilized package in our CM insurance scheme. We spend more than 100 crores in a year for hemodialysis alone. Imagine the expenditure which involves and also the suffering that the individual has to go. So you need to visit the institution at least twice or thrice in a week to get this done. Even though it is available free of cost, imagine the person who need to take him to the institution, the sufferings you have to undergo. If we want to address these type of challenges, we need to control the hypertension. So if we want to control the hypertension, the most cost-effective public practicable intervention is the salt reduction. Maybe as pointed out by sir, இது ரொம்ப சின்ன விஷயம் அப்படின்னு நினைச்சிட்டு most of them will just ignore this. In fact, this is the most cost-effective public health intervention to bring down the hypertension. See, there is already a global document and strategy. If you are able to reduce your current salt consumption by 30%, there will be a reduction of at least 25% prevalence in the hypertension. No cost, limited cost. But if you are able to practice it, definitely we bring down. But this is where this conference is going to address. See, everyone knows that we need to reduce the salt, but how exactly to implement it? This is where the role of the primary care physicians are there. See, unless and otherwise you learn, you practice, you empower the community, things may not happen. So there is already an evidence. You need to translate this evidence so that the public can adopt. This is where the role of you, and definitely we'll do it, sir. And one thing which I like to mention here is that it is no more a medical challenge. It is what we call it as a commercial determinant. See, previously when you used to be a student, we usually talk about agent, host, environment. So the interaction of disease causing a disease. But now it's a more of a commercial determinants is having this problem. See, what is happening is because of industrialization and other things, the consumption of the processed food is increasing. Because of our lifestyle modifications, things are changing. We instantly get attracted to the instant foods, the fast foods. But what is happening is that there is ultimately a overproduction, overconsumption, leading to all the complications, premature mortality. Again, the industry is searching for a new customer through children. See, this is a big cycle. We need to break it at different level to bring down this NCD problem, particularly when you have more ultra high density products which is available, the children are easily get addicted to it. Both salt and sugar are addictive, and it's very difficult to get off it. And because of the quantum which they take, and also the easy availability of the ultra processed food when compared to your fruits and vegetables, it's easy for them to get adopted. Very convenient for them to use it. And for the parents also, this become an easy way of satisfying the kid. This is where the big industrial, corporate, commercial determinants having a big role in the health. This we need to address only through people like you, we can do it. So what is ultimately needed is your lifestyle modification. So even in Tamil Nadu, where we have a non-communicable disease, there's a separate program, Makkale Thedi Maruthuvam, where we deliver the individualized drug package to the individual. Maybe right now we have more than 75 lakh hypertensive in Tamil Nadu, and almost around 25 to 30 lakhs, both hypertensive and diabetes combined together. See, addressing this 1 crore population who are already suffering, it's a big challenge, but we need to address it. We need to prevent the emergence of complications. At the same time, we need to prevent this further emergence. See, unless and otherwise we intervene, this will be a bigger problem, which will be economically difficult to manage also. But what is needed is that, but how exactly do it? The recommended allowance. See, 5 gram, 2 gram sodium, this is all known, but practically it is very difficult to practice by each and every one of us, including me. See, the nutritional facts are displayed, but we never read. Even if you read, you will not understand what exactly it means comparing with the servings which we take. What we always talk about is that a common man who can understand the front packaging label, whether to take it more or leave it. See, this is where the problem, where most of the countries are already adopted either voluntarily or mandatorily, but unfortunately in India, we are still only talking about good manufacturing practices. It's a time we need to move little more forward so that we can talk about how much salt we consume. See, the data, current data says that most of the time, almost 70 to 80% of the salt which we consume is from the hidden source. It is not the salt which we add, but it is the salt which comes along with the food we eat. Now the eating out regularly, going out regularly, ordering the foods, all become very easy. We get the enemy into us and things are happening now. And another big challenge which we need to do it is that there should be certain level of action which we as an individual can do it, and certain actions which we need to do it at a population level or a community level. A government-led instructions also needed, which we'll address. At the individual level, what I usually say is that let us be a mindful eating. So let us see what exactly you are eating, how much salt you are eating. We can start seeing it. So you look for an alternative with a low salt. Nothing wrong in to start with adding little regular food and a little lesser salted food. But the thing is that we have a very good adaptability. Our taste buds will get adopted very quickly. After that, it will become very easy for you to get adapted to the low salt. See, this experience is already with most of our diabetics, where they used to adopt for a sugar illada coffee tea. The similar way, this also can be done. But again, there are many things which we need to do it. Alternative pakla. Our RC sir will always talk about your adding extra salt, the salt shakers. Ning weetli and the kudula salt poradha koraikala. Or even when you go to a restaurant, we can definitely putting this additional salt without consciously. As soon as you get your soup, you start adding a salt. See, this type of smaller intervention, we can do it. And canned processed food or the processed meat is another source of an heavy salt. We need to reduce it. Home cooked food, again, all these challenges that come. We can do it one by one, definitely handling this. And we need to understand that there are many commonly which we right now eat contains more than the required salt. Urgalende, puppetlerende, ungloda order pandra, pizza, pasta, whatever it is, are having more salt. The problem is we don't know that it is having more salt. And how much daily recommended allowance, we are just taking it with one packet of chips. See, this knowledge need to be there. There are many simpler ways to do it. One of the easiest way is that what our RC used to call it as a traffic signal. Number milligram to convert to salt into sodium and into millimoles, it will be difficult for a common man to follow it up. The easy is that if it is green, let's take the required quantity. If it is beyond orange or red, it's better to avoid. See, if this type of common information, if you are able to do it, yes, we can able to achieve it, but it takes longer time. And this is where, in addition to the sharing the knowledge from the experts to the practicing physicians, this team should act as a pressure group or a nudge to change this. Nudge to change this as a government policy. See, this is the easiest intervention once you are able to break through it. There are many countries who are already adopted this as mandatory. Namlo, it is a time where we start talking about evlo kudukurom, yen koraikka kodadu. See, once you start reducing it little bit over a period of time, definitely the same taste what we are right now getting it will continue to have it. But this process has to start somewhere. This is where the Sapiens Foundation or the other experts can act as a pressure group to nudge the industry as well as the government to get into the role. Another big challenge which we face is that at least the brand irukku, number irukku. Now, in the name of local product favoritism, there are many unbranded, unlabeled, locally available vendors cooking, which we don't know what is the quantum of salt or even other trans fat or sugar which you are consuming. It's going to be the big challenge. Third is your restaurant. See, consciously, we can have a little more pressure saying that we can start reducing the quantum of salt. And also, as he fascinately used to say, don't keep your salt sprinkler on the table. If you really need it, let's ask for it. Otherwise, it becomes a common for everyone to adopt it, to use it. In fact, I used to say that whatever the intervention which we used to suggest for tobacco should happen to the salt. This is equally a bigger challenge, and it's all industry-driven challenge. Unless and otherwise, if you have a bigger group, it's very difficult to do it. And finally, evidences. Now, global evidences are available. In fact, Jifina has already developed, this is a global database for your nutrition and food action, already developed a scorecard for every country to measure whether you are on the progress to reach the level they intended. India already, we are one of the top 50 highest salt consuming countries. Tamil Nadu, we are also take more number of salt. It's more than 8 to 10 grams per day. This is very high. Many times, as I said earlier, it all hidden sources. We are not even aware of it. And another thing is that it's a most cost-effective intervention. As I said earlier, every dollar which you spend, the intervention which you, the money which you spend on intervention will give not less than $12 as a returns. Usually we talk only about the immunization, where the cost effectiveness is very high. The similar way, the cost effective intervention of salt reduction, simpler strategy, we need to have a focus, do it, definitely have a huge impact. The impact is on manifold. So one is that you are preventing the occurrence of an hypertension, preventing the occurrence of the complications, and also once you have done this, there is a huge savings on the economic cost involved in treating this. There are threefold interests: reducing the mortality, reducing the complication, prolonging your happy life extended years, and cost saving. This all can be done. And now there are current evidences which I came to know that if you are able to reduce your salt and if you are able to give a little more AC inhibitors, there is a possibility of medulla densa regenerating your tissues, kidney tissues. This says that the effect of the low salt diet or the low salt which you take it will have a huge thing. And finally, it's our duty. So having known this knowledge, we need to prevent the public who are unaware of many things to protect them from this unhealthy diet unhealthy, healthy habits, including the salt, where we'll all resolve to fight together. And definitely, unless and otherwise we intervene right now, the big NCD epidemic cannot be prevented. Thank you very much for the Sapiens team to take this lead, sir. Thank you very much for the opportunity.